The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.
Soaring real estate prices and tight supply of housing are not just big city problems anymore. Tonight, as we continue our collaboration with ROMA, the Rural Ontario Municipal Association, during its annual conference, we ask, what's needed to address the affordable housing crunch in smaller communities across the province? Then, how small and northern municipalities are tackling the other deadly public health crisis, opioids. It's Tuesday, January 25th, and that's next on the agenda. Towns and smaller cities across Ontario already faced affordable housing difficulties. Then came the influx of people during the pandemic, pushing prices way up and supply down. With us now on the urgent need for solutions, and as is our custom, we'll introduce our guests from furthest away to closest to our studio, starting in Petawawa, Ontario, with Lisa Lance. She's a rental agent and owner of Relocation by Lisa. In Westport, in Eastern Ontario, Robin Jones. She's the mayor of the Village of Westport and president of ROMA, the Rural Ontario Municipal Association. In Goderich, Ontario, Wayne Caldwell, professor of rural planning and development at the University of Guelph. And in Roncesvalles, in the provincial capital, Matthew Mendelson, visiting professor and founder of First Policy Response at Ryerson University. Great to welcome you all to our program tonight here on TVO. Let's dive right in. And Lisa, first of all, a special welcome to you. Your first time on television, and we're happy that you're doing it with us here on TVO. But you wear many hats where you are in your neck of the province. And I want to start by just asking about your job as a rental agent there. What does it involve?
Well, the rental agent's kind of something I fell onto. I help mainly military when they're being posted in. We're coming from a military town. I also help CNL, the executives coming in, finding rental properties. And in general, anyone that's really looking. The reason I started becoming a rental agent was because of the shortage. People were having problems. So it just made sense for me to help them.
Gotcha. How's business right now?
It's crazy. I've been doing this for about 12 years, and from pretty much the start, it's been busy, and it just keeps getting busier and busier, and especially since COVID, I can't keep up.
Well, let me ask a crazy question. Isn't that good for you?
It is, but it's fine when you have the properties to work with. But when you have all these people looking and you don't have the inventory, it's frustrating for everyone. It's hard for me to do what I need to do.
So give us an example here. Rents used to be what and now can fetch what?
Well, first off, it's always been an issue to have inventory. And that's, like I said, the reason why I kind of got into it. So the COVID's made it that much harder. But because the rents, even 2018, the average apartment would be, $800. That same apartment since COVID, I'm now renting anywhere from $1,100 to $1,300. Townhouses went from $1,500 to $2,300. So it's a huge jump, especially for our small community.
Get it. Yep, I totally get it. Mayor Jones, you're in Westport, Ontario. So what's the real estate market like in your neck of the woods?
Well, I'd agree with that. In my neck of the woods, there is almost virtually no rental available. And this is a seasonal, so very old Victorian town. It's seasonal from May forward to Thanksgiving. And we've got lots of jobs because we've got lots of stores, lots of businesses. But without having rental income, rental property available, we have to look for a variety of ways so that the people who are working here during the tourism season have a place to live. What happens in many rural communities is it's a trifecta. Westport, say, has the jobs, but no rental accommodation. So the people have to look at the closest community to the village where there is rental accommodation, and they can find no transportation between that community and this. So this is such an impact to our economic stability that it's part of the paper that Roma launched yesterday at the conference.
which we will get into in a second. But again, we are used to hearing about this story happening in the big cities. It's now happening well beyond the big cities of the province. Why do you think it's happening right now?
Well, it's specific to rental. A lot of the rental in rural areas were in large homes that have been converted into 3 or 4 apartments. And with the people coming from urban areas, and let me say, we welcome them. We're thrilled that they want to be part of our community. But what it means is they buy those larger homes, convert them back to single-family dwelling, and the 3 or 4 families that were in there prior to that are now left without rental accommodation. It's a challenge on many levels. People coming in from the farm, seniors who, farmers, people who are seniors, they want to, their church, their community is in the closest village. But when they sell the farm and the farmhouse, there's no place for them to go.
So we've heard from Petawawa, we've heard from Westport. Let's go to Goderich, Ontario now. Wayne, what's the situation where you are?
Probably a similar story, I would think. We have lots of demand, a limited supply. And in addition to that, prices continue to escalate. Function of COVID, of course, a function of retirements, and a function, of course, of the nature of work, more and more people working from home. And the result, I think, is people have been caught unawares with COVID as it's occurred. And the result is significantly higher prices and limited supply.
How much of this was a problem before the pandemic hit?
Yeah, I think it's something that we were noticing before the pandemic hit. It certainly got much worse with the pandemic, but I think, again, the movement to rural Ontario was occurring in advance of that. Certainly the retirement sector was starting to occur, putting increased pressure on housing. But if we look, for example, in Huron County as an example, the average price of houses has more than doubled in the last 3 years, from somewhere in that neighborhood of $250,000 to more than $600,000. And for folks in particular that may have limited income, that's a real issue, a real concern for them.
$600,000 for a home in Huron County?
That's right, yeah.
That is astonishing. Okay, let's go to the
incredible
guy in the big city who's been watching this issue for some time and who has written a report about this. Matthew, I just want to start by you've spent most of your career, obviously, in the big cities of this country. How surprised were you to hear about this happening in rural Ontario?
Well, it's not particularly surprising. We haven't been building enough housing, enough affordable housing for a long period of time. I mean, the evidence is pretty clear that compared to other prosperous countries, other G7 countries, our supply has not been keeping up. It has, yes, as you say, been an issue first in some of the larger cities, but as we've heard, communities don't exist in isolation. Communities exist in kind of complex regional ecosystems, and the relationship between communities and housing supply matters. And so if housing isn't affordable in Ottawa, people move out of Ottawa or Toronto and they move to mid-sized cities, or they move to suburbs. And the relationship between Strathroy or Glencoe is related to housing affordability in London. So to the extent that we haven't building enough supply anywhere and people want affordable places to live, it's not particularly surprising that this problem is going to affect all communities.
Well, let me do the follow-up about the paper that you wrote. And it's, I guess, about a 40-page paper with some ideas in there about what inclusive growth ought to look like in these parts of the province. And why don't we just start off by getting a definition of what you mean when you say inclusive growth? What are you talking about?
So we did a paper with Canada 2020 on new approaches to regional economic development in rural Canada, in smaller communities in Canada. And when we talk about inclusive growth, what we are talking about is a change in mindset from looking at just economic growth, is GDP going up, to whether or not communities are healthy, sustainable, inclusive, whether there is housing, whether there is internet connectivity, whether there are public services, whether there are local sustainable businesses that provide services and benefits and products to people in those communities. So more and more people are looking at ways to measure the health of a community based on, are we building community wealth? Are people healthy? Do people have access to good schools and healthcare? So all of these things are how we focus on economic development right now. And that's kind of a different model from, can we find one signature investment or one big industry that comes in here and creates some jobs? It's about the whole, regional community ecosystem. Are people benefiting from that growth?
Okay, and let's get some views. As you pointed out, many different ways of measuring now what inclusive growth means. Mayor Jones, let me get back to you on this. How would those definitions apply to the housing situation in your community?
Well, not very well, particularly if I could speak for the province as the chair of Roma. The challenges that we have in rural Ontario for housing are somewhat constrained by the fact that most places are not on sewer and water. They're on wells and septic. That's one challenge. The cost of housing, going back to Wayne's comment, the cost of housing going so high, we're paying urban prices in rural Ontario that the local people can't afford them. I don't know if I answered your question, Steve. I was distracted by the discussion on how we measure economic development, and we've included much of what was just said in our paper. So let me answer it that way. Outstanding comments, because we think in 2022, there needs to be other criteria than just GDP. So well done. We are on the same page there.
Gotcha. No, that you answered it straight ahead. And let me follow up with Wayne on that then. These high prices for homes and high prices for rents, what kind of ramifications do those things have in smaller communities in this province?
Yeah, I think, one of the things that it's done is it's pushed up the price of existing housing significantly. And historically, it was more costly to build a new house than to buy an existing house. And now those existing homes are in a comparable price point as building something new. The result is it makes it much more difficult for folks, as I mentioned earlier, on limited wages, to be able to afford something in today's market. And I just think that causes issues for families, it causes issues for communities, it causes issues for services and so on. But there is a positive, I think, that's embedded in that, and that is, in fact, the construction of new housing, because all of a sudden, with those inflated prices, I think it'll become more attractive to developers to, in fact, build. And historically, the market often wasn't there in rural Ontario for folks to invest significantly in new housing development. So I see there's a positive underlying it, notwithstanding the higher prices.
Well, Lisa, didn't you and your husband, in fact, do that?
Yeah, that's absolutely what we're doing and still doing. We're developing properties for rentals, making rental investments, because, of course, we can see the need and what is our community needs for rentals. So we built townhouses. We built a big 39-unit apartment building. We did have the seniors in mind, but to be quite honest, we were flooded with everyone, military, the CNL, looking for accommodations. So we do plan on building other apartments, but, getting through the red tape to get things built is really tough. Who's
red tape? Are you talking municipal or provincial red tape?
Our town itself, just doing the bylaws, what we have to have, the land, making sure we're fitting all the requirements. So it's tough. We have the investors that want to do it. It's just being able to build it and being able to support the rents once we build it.
And once you've got it built, how tough is it to rent it out?
It's not at all. The only problem is the rent's back again. They have to compensate for how much it costs to build things nowadays.
Mayor Jones, I heard some story about a farmer who rented out his fields in your neck of the woods. What's the story there?
That's the idea of them. People come in from rural. Their place is in the village or the local community, and when they no longer can sustain themselves, or as in this example, rented out the farmland, the family was out of luck. They couldn't stay in the community where they had lived their whole lives, where their friends were, where their families and their church were. And I think you'll find that particularly rural mayors, we take this personal because we know these people. They're our neighbors. The mayor in a small rural community is the first person who gets a phone call about whatever, not related perhaps to municipal issues. So we really feel for these people when there's an exodus of seniors out of small rural communities to the urban centers because we can't provide them with rental accommodation.
Matthew, I wonder if you could pick up on Lisa's story from this standpoint. It is pretty clear, as I'm hearing from everybody, that we need more housing stock in this province, all over the place. And yet, from what she's saying, from what Lisa's saying, there still seems to be too much red tape at City Hall, which gets in the way of making that happen. What's the bigger story there?
Well, there are lots of big stories, and there's a diversity of communities and a diversity of different kinds of needs. We've talked about seniors accommodations, accommodation for young families. But I mean, the one big story is a good news story, which is people want to live in Ontario. Ontario is going to continue to grow. It is going to continue to attract people. And because of better connectivity, digital, but also rail, there is the possibility for people and businesses to make all kinds of choices about where they want to live and how they want to live. And rural communities in Ontario, smaller cities in Ontario are all really attractive places to live if you can get a number of policy pieces right, the digital connectivity, the transportation networks, and certainly the housing. And so to me, I think we've reached a point where all governments, municipal, provincial, federal, are recognizing that zoning decisions, administrative decisions, how long it takes to build things, access to capital, all of these things have to move along much, much more quickly with a key strategic focus on supply, on building a diversity, affordable renting, new home ownership, co-op models, all of these things. One thing to remember is the housing market is not a free market. It is heavily, heavily regulated. How you get a mortgage from the federal government, provincial regulations, municipal zoning and hearing rules. So all of these things are defined by policy, and our policies have not been good enough to get the supply we need.
Well, that takes me to Wayne next. Okay, we've heard all of the good reasons why people might want to invest and live in rural Ontario and how things are improving when it comes to broadband, but it still sounds like supply is a bit of a problem. So what do we do to unlock the dynamism of the economy and get more stuff built?
Yeah, it's a great question. And just to say how much I agree with the advantages of a degree of growth in rural Ontario, because we have many communities that have been losing population. So to try to make this happen, I think is in everyone's collective interest. And I think there's a variety of things I think that we can look towards doing. Certainly increased density has been mentioned, both in terms of perhaps mixing low and medium density housing together so that we have pre-zoning, which is to say that if you've got an approval for a single family dwelling or a single dwelling, you also have approval for townhouses and duplexes as part of that. We have second units showing up both in farm properties and elsewhere, and that's already good progress has occurred. The reference has been made to red tape. I prefer to call it green tape because it is important that we remember that those kinds of rules and regulations that often take time are there for a reason, whether it be public health with water and sewer as an example, or whether it be the standards we apply to housing. I think there's a whole variety of things that are there for purposes that are reasonable. We just need to make sure that we make the system more efficient and effective in terms of advancing things. So I think there's those kinds of things. There's turning to manufactured housing and making sure that, and again, this is one of the advantages of somewhat higher prices in terms of increasing profit margins and making it more attractive for folks to actually invest and build in rural Ontario, because historically we didn't have the demand and therefore the construction wasn't happening.
No, I appreciate you making the distinction between red tape and green tape, and I want to go to Mayor Jones on that because green tape we need, right? We need you folks to keep regulations in place that ensure that we've got a healthy water supply and that kind of thing. But red tape, we know too many examples in big cities and little towns all across the province where red tape deters construction because you'll forgive me, local politicians are sucking up to local residents who are already there and who are already voters, and they don't want more density in their neighborhoods. What do you do about that?
So, NIMBYism, I heard another expression for it the other day, which was banana. I don't quite remember what all that was, but it was.
Oh, it's something like build anything. Yeah, what the heck is it? I forget now
Build
too.
absolutely nothing, anywhere, anytime, or something like that.
That's it. Good, Wayne. That's it. Absolutely nothing, anywhere, anytime.
I think it's the challenge is we're not nimble. So there is certainly the issue of the NIMBYism and the ability to make an appeal to LPAT and slows things down. And yesterday I was
better explain that acronym, because LPAT's a new thing.
Okay, Local Planning Authority Tribunal, I think is what it stands for. It's the body that if you disagree with development in your area and other things, but because we're talking about housing development, you can appeal. And developers will try very, very hard to avoid that because it can tie the development up for years. There's just far too many examples. So I think that's when Wayne was talking a moment ago about the green tape, and that we need that sort of those regulations, but we need to be nimble. That we're getting e-permitting, and we're starting to be able to put your applications for building permits through electronically, which is good. In rural Ontario, you still need connectivity in order to do that, but I'll park that for a moment and still say that it is progress. But when the other things for development, whether it's the Conservation Authority has to approve the plans, and the Ministry of the Environment, and I forget what the rest of their Conservation Authority or Conservation they're called, they have to look at everything. There's some blocks there, some slowdowns that if there was a mandate that when the file hit the desk of the ministry, there was a certain number of days before it was turned around, that would be a big help. This is not pointing fingers. They're hardworking people in those ministries, but if there's not an expectation that they've got to be part of the process and speeding things along, then why would they? So I know in my municipality, with the development that we've got going here, we have made the commitment right from the get-go that when we know that there's something that needs to go to council, we will do what we can to adjust the dates so that we are not holding them up. But with some of the provincial entities, we need to do the same.
Well, let's do some real life examples here. Lisa, when you were trying to get more housing stock built in Petawawa, how much of what you encountered would you have called green tape, legitimate, good regulations we want to see, and how much of it was red tape, which was just blocking what you wanted to do for no apparent sensible reason?
Well, my husband's a better one to talk to about this, but I'd say that it was just small things that we get kind of tied up. We're trying to be efficient. We need to get the project going. It's not that the community wasn't trying to work with it. It's just everything was a process, and every little bit took way longer than what we wanted to spend to get things going. It's hard to keep people motivated just before you can even get in the ground. You're a couple years into it. So it's just trying to, I don't know, make things happen a little bit faster, and I totally respect that these things have to happen. It's just being a little bit more efficient on it.
You still sound a little frustrated by the whole thing.
Well, it is what it is. I mean, we've been developing properties, and whether we're building homes or making subdivisions, and it's just the process. It's just how it is. For me, I want things to come along so we can start getting that supply for people so they're not so frustrated. And part of the reason why the rental prices went up so much, especially during COVID, was obviously because we didn't have the supply. So I would put, say I put an apartment on Kijiji or my website for, say, $900, a reasonable, affordable property. I would get 30 applicants coming in, and then the bidding war started. So even though you're trying to keep, things at a reasonable, affordable level in renting, everybody just drove the prices up, so the next thing you know, people were offering way more. And in my 12 years of being a rental agent, this just wasn't something I ever had to deal with. And all of a sudden, the average person couldn't even stand a chance to get that property because they were getting outbid.
Gotcha. Wayne, let's do a real life example from your situation. You got a piece of property, I gather, in Goderich, and you built a second place on it for your son. How did that go?
Well, actually, it's fantastic. I'm in it right now. We're on a farm actually, and sold the farm to our daughter a number of years ago, and we built a garden suite on the farm. And we've been here full time with COVID for the last couple of years, and we'll be full time here once I eventually retire. And it's fantastic. It's on the small side, a touch over 1,000 square feet, and meets our needs wonderfully.
And what about the green tape versus the red tape? How much of that was involved?
There was some of that. We had to go through agreements with the municipality, but I suppose I was fortunate in that I know the planning system and understood the local bylaws and what they were wanting to achieve. And we worked with that. We have a shared driveway, shared water, shared septic tank, shared hydro, all of those things that I think from a policy perspective are appropriate in terms of allowing a second unit on a farm.
And as long as you stay on speaking terms with your kids, I guess it's all going to work out fine.
Absolutely right.
Okay, good luck with that.
Yeah, absolutely. But it's one of those weird things. You go through a process. We entered into a legal agreement as we were advised to, and it's always funny to do that with someone you love. But it was the right thing to do because circumstances change over time. So it's good.
Indeed. Okay, Matthew, you're the policy guy. Get in here. How do we, what needs to happen to unlock more potential and get stuff built?
It'll be frustrating that there's not one simple, easy answer. There's a diversity of solutions, but we have to be working on all fronts simultaneously. This is a problem that has been decades in the making. Large cities felt it first, then some mid-sized cities, and now rural communities are feeling it. But it's not going to get fixed overnight. I mean, the people, my colleagues here on the panel, have been talking about very specific local situations and challenges that, again, we're not going to fix tomorrow. But the federal government has a role in terms of supporting or challenging questions around foreign buyers, around investment properties, around house flipping. There are rules that can change to make it easier to do co-op housing and to do co-op development with not-for-profits. The province right now has a task force that is looking at, likewise, how to make lands available, how to streamline the process. Cities can do inclusionary zoning and make sure that there are affordable rental units available when doing new developments. We can eliminate some rules and regulations. So if you're converting a single family house to a duplex or triplex, you can just do that. If you can build a second property on your house, on your property, you can just do that with very, very minimal rather than lots of administrative processes. So there are a whole bunch of different things that all governments have to be working on. And it's a bit that it's not going to get solved overnight, but I'm optimistic that there seems to be a growing consensus across all governments and communities that we need to make it easier to build houses of all different kinds and affordable houses of all different kinds, and that governments are working on this.
Well, okay, let me take that checklist and go over to Mayor Jones. I mean, some of the things that Matthew just mentioned are obviously in federal and provincial jurisdiction, and you can't do anything about those. But some of the things he mentioned are they're in your sphere of influence, and I wonder how much political appetite there is to go ahead with some of those things. Increased density, allowing people to build second units or convert to triplexes without having to go through a song and a dance. Do you know whether City Hall is open to that stuff?
Yeah, I believe they are. Particularly the secondary suites. Pardon me. The legislation was changed by the province to allow municipalities to make those changes in 2019, and we're starting to see it roll out now. So it might have been the push that the municipalities might have needed is the housing crisis that we're in, but I'm not hearing resistance to any of the suggestions that he's made by my colleagues across the province.
Does that mean it's going to happen?
Oh, I think so. The the reality is we have to, first of all, look to see what we can do in municipalities, and those are some of the things. The density issue doesn't really impact us as much in rural Ontario as it does in urban, but the secondary suites or the additional properties on farmlands is something that is talked about. And as I say, in my own municipality, we have just actually done two things. We've taken the provision or the granting that the province has provided through social housing for the secondary suites, and we're also putting aside in our budget. We hope to pass another stream of doing secondary suites. So I think it's going to happen. It's part of the way of finding a solution. And quite frankly, Steve, the public's demanding it. They need options.
Okay.
I see lots of people nodding their heads on that last point that you made, Your Worship. So I'm going to take that and run with it and thank all four of you for joining us on TVO tonight. Lisa Lance, Mayor Robin Jones, Wayne Caldwell, Matthew Mendelson. Great of all of you to spend so much time with us here on TVO this evening. Be well.
Great.
Thank you.
Thanks.
COVID-19 is not the only public emergency that public health units in this province are contending with. The opioids crisis is wide and deep. With us on what that looks like in rural and northern Ontario, we welcome, in Timmins, Ontario, Michelle Boileau. She is a Timmins City Councillor and Chair of the Northern Ontario Service Deliverers Association. In Sudbury, Ontario, Crystal Kimawan, support worker at a 24-hour emergency warming centre at the Sudbury Action Centre for Youth. And in Barrie, Ontario, Dr. Lisa Simon, Associate Medical Officer of Health for the Simcoe Muskoka District Health Unit. And we're pleased to have all three of you on TVO tonight to help us with what is, unfortunately, still a terrible health crisis in the province of Ontario. Let's just put some graphics up to start with to set the table for the discussion to come and give people some of the background they need to understand this story better. Researchers recently released a comparison of the number of opioid-related deaths in Ontario prior to and then during the first 9 months of the pandemic. And here's what they found. From March to December 2019, 1,017 opioid-related deaths. Let's go a year later, March to December 2020, 1,808 opioid-related deaths, almost twice as many. A breakdown of the demographics is also particularly telling. There's been a twofold increase in deaths among men, a 79% increase in those between the ages of 25 to 44. And of particular concern, the pandemic has seen a 300% increase in opioid-related deaths in Northern Ontario compared to the southern parts of the province. And if we can do one more here, when you look at the population-adjusted opioid-related death rate by geographic location, for those listening on podcast, I'll just go into a bit of detail here because you can't see this. Suffice to say, the surge in Northern Ontario is clearly there. Look at that third set of bars. That red Northern Ontario bar during the pandemic period has really shot up. But it's also noteworthy that this is a rural problem as much as it is an urban problem. And when we look at location, urban, rural, northern, southern, everything's going up, but it is particularly an issue in Northern Ontario. So let's get into this. Dr. Lisa Simon, let me start with you. From a public health perspective, how does the opioid crisis and the deaths that it is causing compare to COVID-19 in parts of this province?
I think the bottom line is that they are comparable at this point, orders of magnitude in terms of what we're seeing of the impact of the opioid crisis and related deaths is dramatic and hugely concerning. I can speak to the numbers in my own region, which is Simcoe and Muskoka, during which, over the course of the period of time in the pandemic for which we have data on opioid-related overdose deaths would be from April 2020 to June 2021. We saw 100 795 people lose their life to opioid overdose during that time. The comparable COVID-related deaths in our region were about a quarter higher than that, around 246 deaths. So it's a similar number. And I think it's also important to note that people who are losing their lives to opioid overdose are much more often a younger age. 60% of the individuals here who lost their lives during that time were between 25 and 44 years old. So they're in the prime of their lives. I mean, every life, no matter what the age, of course, is of great value, and we want to prevent those deaths. But it is noteworthy when looking at the impact. So I mean, lots of differences, of course, between COVID and opioids, that the situations can't be directly compared. But I do think we can say that the opioid situation, the scope of it is huge. The impact is dramatic. It was prior to the pandemic, and it is only worse now.
Let me do a quick follow-up with you on this, because the numbers of deaths are comparable, as you say, but opposite, right? I mean, COVID is a disease that is fatal, particularly the older you are, whereas opioids appears to be a much more fatal phenomenon for those who are younger.
Correct.
99% of what we've been hearing for the last couple of years is COVID, and we hear precious little about opioids. Why do you think that is?
I think it's a good question. I think it's one that we need to keep asking. And I think part of it is that COVID is relatable for everybody, right? COVID has impacted every aspect of our lives. Everybody knows somebody who's had COVID, and everybody has felt the restrictions in place because of COVID. With opioids, sometimes people, or with overdose deaths, or with addictions in general, sometimes people feel that it's not something that directly impacts them. And so they may not be as concerned or as outraged about the deaths that are happening and about the need to do more about it. So I think the more we are aware of what's happening, how it's impacting those who are suffering, as well as the broader community, there might be more of a groundswell to increase the attention and the prioritization that this issue receives.
Let's go up to Timmins and find out what the situation is like there. Michelle, how would you describe the opioid epidemic in Timmins?
Well, I would definitely describe it as a crisis. It's interesting that you should ask the question to the doctor about how the numbers compare between COVID and the opioid crisis. And quite frankly, up in Timmins, there are more deaths due to overdose than there have been related to COVID. So it does show the magnitude of the issue that we're dealing with here. I would also say that arguably everyone in Timmins does know someone that's been impacted by the opioid crisis. And so I would say that has driven us in the past few years to really take strides in terms of trying to address this issue locally. But it's a major issue that our municipality and the region is struggling to deal with.
And let me ask you this follow-up, because COVID is everywhere. You see it when people wear masks. You see it when you have to present proof of vaccination to go somewhere you want to go to. So it is omnipresent in that respect. The opioid crisis may be less so to many people, but I wonder in Timmins whether or not in people's daily lives, whether it's visible.
It is, and it's become much more so, especially with the onset of the pandemic, with everyone moving indoors and staying home. It really shed a lot of light on what was actually going on the streets here in Timmins. And so a lot of people think that this is a bigger city issue, and suddenly we were starting to see it on our main streets because with less traffic in the downtown core, understandably, it was just a lot more visible. So it's something that we're seeing, especially because we are dealing with, housing shortages, increased homelessness rates. So it's definitely something that is now present on our streets. And interestingly enough, in the past few years, it's really become an issue that's migrated from what would be encampments in the bush outside of the city boundaries, and it's really migrated into the city. And so it's become something that's been a lot more talked about, which has been positive in a sense because it has allowed for us to really move things forward.
Crystal, as I get you into this discussion, let's just get some background on you, because you've got experience on this file in a way that others do not. First of all, you're in Sudbury right now, but you're originally from where?
I'm from Wakwamacong, unceded Indian Territory on Manitoulin Island. So I am First Nation. I am Indigenous. I do possess a lived experience. So
that's
that
what I wanted to
sets
get
me
into, because you've been trained as a social worker, but I gather you don't call yourself that. You call yourself a peer. Why is that?
I refer to myself as a helper. I don't like the term social worker. I began this type of work as a peer, so supporting other women within the very circles that I sought help within. Naturally became an advocate and guided into the field of social work. I found in order for my voice to be heard, I needed to have an education. I needed to be on par with colleagues and to be able to have a voice at tables that we're designing policies to meet our needs as people struggling with addiction.
Totally understand that. Can you, and again, I don't want to invade your privacy too much here, but on the other hand, I think we need to understand why you know this subject so well. So can you tell us about your connection to addiction and how it happened?
Everybody's story is different. Mine rooted in trauma, 60s scoop, all the traumas affecting Indigenous people as a whole. I also think it important to note that the Chiefs of Ontario actually came out with a study in partnership with the Ontario Drug Policy Research Network that came out with a number of 132% increase at the height of COVID for Indigenous death by opioid overdose, and 68% increase for the rest of the population. I think that important to note. I've been frontline since the start. So how the pandemic impacted service delivery, I was actually working for a social services organization down south. And we were just not prepared. We were not prepared for how services would be impacted. Where I directly saw it, and when we talk about the ages, 25 to 44, those are families, those are mothers, those are parents. I want to say within the first 2 months of pandemic, we lost 3 mothers to overdose. When you look at how services are directly correlated, or helping services directly correlated to a mother's recovery, access with her children, and then you take that away all of a sudden, that impacts a mother's recovery in a way. Without those supports, like I said, a lot of our services were not prepared. We were not prepared at how COVID would impact how we service our community members.
So the pandemic has made things infinitely worse for you.
I think there has to be a word far greater than that to describe this. But yeah, definitely.
Okay, let's get some more information on the table here. These are stats from that recent report by the Ontario Drug Policy Research Network, and we'll bring those up now. 1 in 2 victims of opioid-related deaths had an encounter with the healthcare system in the month prior to their deaths. 1 in 4 victims had an encounter with the healthcare system in the week prior to their death. 1 in 3 people who died during the pandemic had accessed opioid agonist treatment in the past 5 years, and 1 in 10 had done so in the past 30 days prior to their death. Now, Dr. Simon, we need a bunch of explainers here. First of all, opioid agonist treatment. What is that? Let's start there.
Sure. And I will just start by saying I'm a public health physician. I'm not a clinician. I don't see patients. I don't treat people for opioid use disorder, but I'm certainly happy to help with the basics of it where I can. So opioid agonist therapy are medications, first-line medications that are used to treat opioid use disorder or opioid addiction. The most common ones are Suboxone and methadone, but there are also other options.
And what do those statistics tell you?
Those statistics about healthcare system access, and I think that the report you referred to expressed those well, and we've seen similar statistics in our own region through data collaboration with Statistics Canada. We know that people who are dying of opioid overdose have often had interactions with the healthcare system and sometimes with social services, justice systems in the period of time prior to their death. And so, what we are all working to do and need to increasingly do is use those opportunities to check in with individuals who may be at risk and see how we can optimize the health and social services that they're accessing. Do they have more needs from a treatment point of view, from a harm reduction point of view, from a housing point of view? But these are folks who are connected in one way or another, but clearly there are missed opportunities.
Can you help us understand this better, though? Because the assumption would be if you've had an interaction with the healthcare system, then theoretically you should be far less likely to be dying a week or a month later of your addiction. What's going on here?
So, a couple things. Firstly, most of these interactions are probably not related to the opioid use disorder that the individual may have, or they may not even have an opioid use disorder. We actually know that maybe 2/3 of people who are dying of opioid overdose from that recent report seem to have an opioid use disorder. The others are just perhaps using sporadically, but they may have interacted with the healthcare system for all sorts of other reasons, whether it be an injury or mental illness or physical illness or what have you. And so one may not have broached the issue of substance use at that time. The other option is that they were being seen for something related to their opioid use disorder if they have one, but they may not have been connected with all resources that would have been helpful to them. So, for example, maybe they went into the emergency department for an opioid overdose. They were treated appropriately and they were discharged. Did they receive at that time, though, as a basic take-home naloxone to help with reversal of future overdoses? And also importantly, did they have opportunity there to be offered the initiation of opioid use disorder treatments such as Suboxone, or connections with treatment programs for counseling or opioid agonist therapy in follow-up if they wanted it? So there's all sorts of opportunities that these interactions present, even if the reason that brought one in is or is not related to opioid use.
Okay, let's get the view from Timmins, because Michelle, I know that you work with some of the people who are providing healthcare services. What are they telling you about the crisis from where they stand?
Well, I think it definitely has a lot to do with the fact that there's a lack of access to healthcare services in the region, and notably a lack of access to mental health care services. And so, as the doctor was mentioning, I think it definitely has a lot to do, and that's what we're seeing here in Timmins, is that people were presenting themselves to the emergency department and were being released after just a basic treatment, essentially just treating them for their anxiety and sending them back out after they've hit a certain level of recovery, but they weren't being connected with those community resources. And that's what really drove two of our emergency room doctors to take action. And so they were able to initiate the implementation of 2 acute withdrawal management beds at our hospital. And so instead of releasing people back onto the streets, they were giving them the opportunity to actually go and deal with their withdrawal symptoms in a medical setting. We're also starting to see the introduction of the connection to programs such as the Suboxone programs and such. And that's something that wasn't happening until the very end of 2021 here in Timmins. And so I think that the increase in the stats and the death rates is definitely due to the fact that people weren't being treated for their acute opioid addictions when they were presenting themselves to medical services. And I would also say that once a person starts on their path of recovery, their tolerance level will definitely change. And so if they're not connected with the right supports, then if there's a chance of relapse, the chances that relapse results in death are much higher than they might have been before. And so that's why it's really important to always be following up with these people as they continue on their path to recovery, and making sure that they're being connected with the right resources. But when we deal with the lack of medical resources here in the region, and we have a shortage of physicians, a shortage of mental health clinicians, and we're now even just starting to see a shortage of your basic social services. It means that people are being left to their own devices, trying to see out their recovery. And unfortunately, if they slip, the right services aren't there to help pick them up.
Well, let me pick up on that because I want to better understand whether the key problem here is an inadequate amount of services in the hospital setting or in the community setting. Which is the bigger issue?
It's such a complex issue, and I would say that it's across the board. But what we were seeing in Timmins was that there was definitely an issue with in the hospital setting, even just in terms of the medical staff's attitude towards the issue. And as we were saying, now that we're talking about it a lot more, the way we've talked about this issue has changed here locally in the community. There's been a lot of education and a lot of awareness that's been done, and at the medical professional level. And so now the hospital has really joined forces as a team to help treat people that are dealing with acute addiction.
Okay. Krista, let me get you back in here because, again, from your firsthand and frontline experience, I wonder if you can convey to our viewers and listeners what this issue does to people, does to their families, does to their friends. Give us some sense of that.
Okay. I work frontline in, I want to say, a last resort for our homeless, our substance using community members. When we talk about issues, they're across the board within hospitals. Funding from city is limited. Service provision is limited. Frontline workers are burning out. And that's the reality of it. Within the organization that I work within, it is hard just to even keep our floor staffed. I want to say this is directly correlated to the lack of services that are within community, support circles, recovery support circles, organizations that would have been open during the day to have coffee and go and have tea and connect with other community members. We're also seeing that Sudbury has the highest rate of opioid overdose in Ontario. And this is huge. What we're facing on the front line is, honestly, I don't even know how we're getting through it. I really don't. I think it is an amazing team of frontline workers. Primarily, a majority of us are peers. We're peers who have gone to school, gone to college, gone to university to be able to give back to a time and space that we have a connection to. Our city can help with housing. We've lost, I want to say, 2 people that I know of that have recently been housed from being homeless have overdosed in their home, in their newly acquired home, because this is a community, this is a sense of, and then you displace this individual and place them in without those supports. And this was mentioned across the panelists here, without those supports following this individual to their new home. You're disconnecting them from community. And the grief. Every week we're losing somebody. Every few days we're losing somebody. And that grief that is felt on a community level by this is family. This is family within these organizations that we work within. And we're burnt out. We don't have service providers for us as frontline workers to be able to do the work we need to do to be able to return to work the next day. And I cannot stress this enough. COVID has greatly impacted. And increased the rise. I see it, I feel it, I live through it every single day. I lost my partner a year ago.
I'm sorry.
6 months or a year prior to that, not even a year, we lost his sister to overdose. 4 months prior to that, he lost his niece to overdose. So this is what we're functioning in as frontline workers. And I think that just the fear of being COVID and the spread of COVID is really restricting a lot of workers from doing what they would have done prior to COVID, I guess. The connection and just something as simple as hugging a community member goes a long way. After they've lost a friend or family member.
I'm so sorry for your loss, and I want to take that that tragedy and put it into a question for Dr. Simon, and that is, you've shared the numbers with us. So maybe we should finish off on this. You've shared the numbers with us that opioids and COVID are comparable crises in many parts of this province. We well understand what resources have been brought to bear to fight COVID. Is it time to declare a public health emergency as it relates to opioid addiction?
First, I do want to express my sadness at Crystal's losses that you've described and the trauma that you and so many others are facing on the front line. Very understood and appreciated for all the critical work that you and others are doing. In terms of the issue of an emergency and if the opioid epidemic should be declared an emergency. So in my mind, there is no doubt that the magnitude of the crisis is an emergency. In notion, it is an emergency and it needs to be prioritized in an urgent and very strong way to get in place the resources, the policy change, and the coordination that we need to address this issue better across Ontario and across Canada. If declaring an emergency would help achieve that, then that is something that absolutely the provincial and or federal governments should examine. I say that because the declaration of an emergency is a formal regulatory action. And so that needs to be considered. I think prior to COVID, typically we thought of emergencies being declared in very short-term ways with fairly clear short-term fixes, of which, of course, the opioid crisis doesn't fit. It's a chronic, extremely complicated issue. But COVID has changed the perspective on that a bit, and you can see the way that we've used emergency legislation to help us manage the COVID pandemic, and I think that gives some insights as to what may or may not be helpful in managing the opioid crisis. So I think the question does need to be addressed by the provincial and federal governments. But regardless of whether or not we formally declare an emergency, what we do need to do is up the prioritization on this issue in terms of the extent of commitment, resourcing, conversation, and policy action that we see to address it.
And that message has come through loud and clear from Dr. Lisa Simon, Michelle Boileau in Timmins, Crystal Kimawan in Sudbury. I want to thank all three of you for coming on to TVO tonight and having a very hard conversation about a hugely important topic. Thank you so much, you three.
Thank you.
Thank you, Steve.
And that is the agenda for Tuesday, January 25th, 2022. Tomorrow, we will catch up on the increasingly tense situation in Ukraine and why NATO is bolstering its forces in Eastern Europe. I'm Steve Paikin. Thanks for watching TVO, for joining us online at tvo.org, and we'll see you again tomorrow.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.